So thank you all on this very, very snowy day in New York. We're really glad that we can do this virtually and so people can join from wherever they are today. Okay.
Yes.
Okay, great. So thank you everybody for being here. This is our February CSEP Childhood Cancer and the Environment Program webinar series. Um, Today, we have the pleasure of welcoming our colleagues from Spain. Last November, I actually was able to spend some time in Spain with them and see their amazing work. And so I'm really excited for them to present to us today. Their title is Guardians of Planetary Health and Environmental Intervention to Transform the Prognosis of Pediatric Oncology, Patients Undergoing Active Treatment. And today we will be hearing from Dr. Juan Antonio Ortega Garcia. He's a pediatrician, researcher, and professor of pediatrics at the University of Murcia. He trained in pediatrics at the Hospital La Fe in Valencia, Spain, and received his PhD, which focused on childhood cancer and environmental determinants of health. Since 2005, he has led the Pediatric Environmental Health Specialty Unit of Murcia, or PEHSU-Murcia, a program recognized by the World Health Organization Europe and the Spanish Ministry of Health for its innovative models of care. And under his leadership, PEHSU-Murcia has developed the pediatric environmental history and the Green Page, or Hoja Verde, which has pioneered the integration of exposomics, environmental intelligence, and anticipatory survivorship care into routine pediatric oncology practice. We are also joined by Dr. Isabel Martinez Romera, who graduated from medicine from the University of Murcia in 2007 and went on to residency in pediatrics at the Hospital Niño Jesus in Madrid. She then completed a fellowship in pediatric hematology and oncology in Madrid. She did her doctoral thesis about the role of NK cells in pediatric acute lymphoblastic anemia in Madrid, and she currently works at La Paz in Madrid. She spent 2 months in the PEHSU-Murcia in 2023. We're also joined by Francisco Díaz Martinez. He's an environmental health researcher at the PEHSU-Murcia, and Dr. Alba Mateu Gallardo, who is a fourth-year pediatric resident at the Hospital San Juan de Dios in Barcelona, Spain. My apologies. I'm sure my pronunciation is not great. So without further ado, thank you guys again for joining us. We're really fortunate to have you today. I'm going to stop sharing my slides so you guys can take it away. Thank you again. I think you're on mute.
Hi, Hannah. Thank you. Okay. I would like sharing a little presentation with the audiencia. Si es possible, Hannah, yes? Sí? Okay, compartir. Okay. Good afternoon, everyone, dear colleagues and friends. I am Dr. Ortega. It's an honor to be here with the Childhood Cancer and Environment Network. I come from Murcia, a small Mediterranean region in Spain, as in the south of Spain, but with a big commitment to childhood cancer and planetary health. For 25 years, within a universal public health system, we have been building something very simple and very ambitious. We integrate environmental history, environmental health into pediatric oncology care, not as an alternative, not as an accessory, but as a part of standard care. I lead the Pediatric Environmental Health Specialty Unit in Murcia, in public hospital, Virgen de la Arrixaca, since 2003. Every child diagnosed with cancer in our region is referred to our unit for structured environmental assessment and long-term follow-up. We work inside the public system. Our unit is included in the hospital. It's a reference center of the environmental health for all people in our region, all children with chronic illness, cancer with another pathology. We are embedded in oncology, primary care, and community health. This integration is in our strength. We have many challenges, environmental challenges, industrial, manure, saltwater pollution, polluted, tobacco smoke. The level is very high in Spain. Agriculture with exposure of pesticides with another chemical, refinery emission, and also we work. We have developed pediatric environmental history in 1,000 approximately the children and families with cancer. We have been followed in our survivorship program since 1998. We work together with 18 primary care center. Follow-up is not for 5 years or 10 years. It's important in our program to transmit this for life, as long as families want. I think that is authority built on continuity and trust. And our approach is based on un model. In PEHSU, we have developed profile professional and new capacities. For example, as can you see, the family doctors, Alberto, Miguel, environmental nurse, or Francisco is environmental scientist. We have developed new capacity in our public health system. I think it's very important because in planetary health approach in the future, we need develop for healthcare system new capacity and new role professional. And you can see in this slide the people that in Spain working in PEHSU San Juan de Dios, in PEHSU Olot, in PEHSU La Paz, all medical pediatrician, environmental nurse, scientists, biologists. So working together with a methodology, developing the core structure is the clinical tools, such as pediatric environmental history, green phase with another. This picture is the last month, the first time for me, all PEHSU in Spain meeting together in Barcelona. It's very important because during the next 5 years, I would like to incorporate 10 PEHSU more in our country. It's need to explain that PEHSU, the work the PEHSU is incorporated in the public health system. It's very important for us to explain that because similar to cardiology, pneumology, or allergology, pediatrics, there are pediatricians in our pediatric environmental health incorporate in our hospital. So it's very important. Our approach is based on what we call anticipatory medicine. Anticipatory medicine, primary prevention, secondary prevention, and tertiary prevention, all integrated. Even after diagnosis, prevention does not stop. In fact, it's become more important. We assess modifiable exposure, tobacco smoke exposure, indoor and outdoor air pollution, household chemical, socio-ecological stress, lifestyle, quality of life, and survival. not to blame families, but to reduce biological vulnerability during treatment. We have developed an all children diagnosed with cancer in our region, working together with oncology. Pediatric environmental history is incorporated to develop. It's important sharing with you in this moment. Now we are moving upstream. Es decir, río arriba en español. We are working with childhood cancer surveillance to explore with preliminary data how environmental exposure and lifestyle interact with treatment-related mortality. Not only are working to diminish for prevention, screening, and early detection of late effect. Okay, all guidelines in the world, in USA and Europe, incorporate this pillar. But the pillar most important working in PEHSU is education and promotion of the lifestyle and create environmental healthy for children with cancer, because we can working with the modifiable risk factor. In this moment, working Rio Arriba, upstream, we are exploring the possibility of the improved morbidity and mortality with related with treatment. This is the pillar fundamental of the Guardianes de la Salud Planetaria. Because survival is not only about surviving cancer. It's about surviving in a changing environment. We are developing digital tools like HealthWare Digital to personalize environmental risk assessment and support clinical decision. And we are building what we call an embiomic approach. Embiomic is integrating genome, exposome, socio-ecological factor, biomarker, AI. It's a holistic approach to incorporate in the oncology care, environmental oncology care, and in patient during treatment to reduce preventable harm. This is not theory. It's a clinical platform inside a public hospital. But leadership is never alone. Mark Miller is a pioneer. There are many pioneers in environmental health in USA. It's difficult building environmental health alone. Today, I am proud to introduce Isabel Martínez de la Paz, a key collaborator to training in our environmental clinical integration in childhood with cancer. Dr. Alba Mateu, pediatric resident from Hospital San Juan de Dios in Barcelona, currently training with us in Murcia, representing the next generation of environmental pediatrics. It's very important for us, this presentation here for us. Fran Martinez is represent new capacity, new profile professional incorporate in public health care system in Spain. We need to incorporate ecologic professional, environmental scientific in public health system. How is leading the operational development of the Rio Arriba program, working daily with the survivors and generating preliminary translational data. They represent continuity, rigor, and the future of this model. This model needs a Murcia long time ago, but in this moment we have very happy and very esperanza because many people talk in our door to participate, training, develop activity. So yeah, I think maybe in 2030, 15 PEHSU in Spain. Murcia is small, but the model is scalable. We have demonstrated that environmental integration in oncology is feasible inside a tax-funded public system with high survival rates and long-term sustainability. We believe This is not a local experiment, it's a transferable framework, and we are open. If any young pediatrician, oncology, or public health physician from this network is interested in training with us, even for a short stay or more long, outdoors in Murcia are open. Also in Madrid and Barcelona, we believe in exchanges. We believe in transfer. We believe in building a global movement. Today, integrating planetary health in childhood cancer care may also seem ambitious, but we have been doing it for 25 years, quietly, consistently, inside the public system, and we are just getting started. Thank you. So, it's true. I would like to present our colleagues related experience, Isabel, Fran, and Alba. Um,
Okay, I'm going to start with my slides. 1 minute to share my presentation. Okay. First of all, good afternoon, everyone, and thank you so much for the invitation. My name is Francisco Díaz. I am an environmental scientist working at the Pediatric Environmental Health Specialty Unit of Murcia. And today I'm here to share our project with you in a presentation titled Early Environmental Intervention During Active Cancer Treatment, Air, Diet, and Real-World Exposure Control. Today's presentation is divided in two main parts. First, we will look at our baseline screening to understand the environmental risks our patients face. Second, we move from diagnosis to action, presenting environmental intervention program and our preliminary clinical results. To provide some context, childhood cancer remains today the leading cause of disease-related mortality in the population aged 0 to 19 years. Each year, more than 400,000 new cases are diagnosed worldwide, according to the WHO, with leukemia, central nervous system tumors, and lymphomas being the most common diagnosing groups. In Spain, the incidence is around 15 cases for 100,000 children, and survival has improved significantly thanks to therapeutic advance, now reaching 82.5% and up to 85.5% in the region of Murcia. However, treatment-related mortality, meaning complications derived from chemotherapy or infection, remains a relevant problem, accounting for 10 to 25% of cases. This poses a new challenge. It's not enough to cure cancer. We must also care for the environmental and conditions that influence prognosis and quality of life during after treatment. Take a moment. Yeah, sorry. Yeah. Today, we know that environmental factor and lifestyle behavior can influence not only the risk of developing cancer, but also its progression, treatment response, and long-term effects. Common exposures such as tobacco smoke, plastic, pesticides, and air pollution can generate oxidative stress and alter immune response in patients. In this context, the Pediatric Environmental Health Unit of Murcia has developed the PEHSU-Murcia program, focused on prevention and the improvement of environmental health, focusing long-term effects after treatment. Within this framework, we created the digital tool Planetary Health Guardian, designed to comprehensively set its pediatric patient environmental profile and provide personalized recommendations. Our ultimate goal is to integrate environmental health into clinical practice, moving toward a more personalized, preventive, and planetary approach to pediatric oncology. The main objective of this program is to characterize the environmental health profile of pediatric oncology patients during the active phase of cancer treatment in order to identify potential risks and protective factors that might influence their health outcomes, including treatment-related mortality, disease progression, and overall cancer trajectory. To characterize the environmental health profile of pediatric cancer patients, we conducted a cross-sectional descriptive study between March and May 2025. A total of 100 children undergoing active oncological treatment at the Virgen Arrixaca University Clinical Hospital participated. We used the digital tool Planetary Health Guardian, developed by our unit, which evaluates 5 major exposure domains: home and family environment, general environment exposure, parental occupation, lifestyle factor, diet, and participation in healthy activity. On the right in the screen, you can access the questionnaire we use by scanning the QR code. Data were collected through in-person interview and a digital questionnaire, which also generated personalized recommendations for each family. The first response we conducted by a final year medical student, and I currently do them myself on a weekly basis. With this methodology, we aim to obtain a comprehensive snapshot of the patient's everyday exposure during treatment. In the result, we identify a complex environmental profile with frequent and, in many cases, modifiable exposure. In the home environment, nearly half of the patients live with pets, and 2 out of 3 consume bottled water in plastic containers, potentially increasing exposure to microplastic. Regarding environmental exposure, 38% live with tobacco smoker and 10% with cannabis smoker. Almost half of the family reported using the household or garden pesticides, and 1 in 4 children perceived poor air quality. Additionally, around 50% of parents working in sectors with chemical or biological risk, which may imply indirect exposure within the home. Regarding lifestyle factor, we observed that just over half of the patients ate freely daily, but more than 70% spend over 2 hours per day in front of screens, and only 1 in 5 engaged in regular outdoor activities. Despite this, 69% of families expressed interest in participating in nature-based workshops, suggesting a high level of resistivity to preventive intervention. Overall, these results reveal a profile characterized by environmental and behavioral risk factors, but also highlight a real opportunity to promote positive change in health and quality of life among pediatric oncology patients. The results highlight a huge exposure to modifiable environmental factors such as tobacco, plastic, and pesticides. This exposure can promote oxidative stress, immunosuppression, and reduce treatment response, directly influencing the cures of childhood cancer. However, they also reveal a significant opportunity to integrate environmental health into pediatric oncology care in a preventive and holistic way with the support of oncologists and nurses in the pediatric oncology department. We also know that contact with nature can modulate immune function and reduce physiological stress, improving biomarkers such as cortisol or hemoglobin A. Ultimately, this approach moves us toward a more ecological, personalized, and child-centered model of care, and has already enabled us to design tailored intervention for some of these patients. Based on the environmental profile identified in our cohort, we developed a home-based intervention within the Planetary Health Guardian Program, focusing on patients who reported a self-perceived environmental contamination score about 7 or more, or the presence of at least one smoker at home. The aim is to translate environmental assessment into clinical action, targeting modifiable exposure during the most vulnerable phases of treatment. At the moment, 6 families are actively enrolled and under follow-up. This is a longitudinal home-based intervention designed to accompany families during active treatment, particularly during the most immunosuppressive phases. Each family is followed for 1 year, integrating environmental, behavioral, and clinical data to better understand how the home exposure may influence outcomes. The intervention begins with an environmental screening and personalized plan adapted to each household. Families receive practical education and recommendation, and HEPA air purifiers are installed in the main living areas. This purifier combines an activated carbon filter with advanced photocatalytic technology to neutralize harmful molecules and pathogens in the air and on surface. We then conduct weekly follow-ups to monitor environmental change, adherence, and clinical events. Also, this is a small preliminary sample of 6 pediatric patients with diverse oncological diagnoses, including leukemia, CNS tumor, and sarcomas. We are observing good feasibility of the intervention and strong family engagement, with consistent adherence to environmental recommendations. Currently, the patient with the longest follow-up has been monitored for 8 months, and the patient with the shortest follow-up has been monitored for 3 months. The average follow-up time per patient is 5 months. Despite relatively high baseline environmental exposure score range 7 to 9 and the presence of household smoking in most families, none of the children currently under follow-up have required hospital admission due to respiratory viral infection during episode of fever or neutropenia so far, and no ICU admission have occurred. This finding should be interpreted with the caution given the limited sample size, but they provide an encouraging early clinical signal supporting the potential role of home environmental intervention during the active cancer treatment. This early result reinforced the idea that environmental care can be considered a form of supportive therapy in pediatric oncology. The home exposure represents a modifiable determinant that has traditionally been overlooked in clinical practice. Finally, integrating planetary health into cancer care may help us move toward a more preventive, personalized, and holistic model of pediatric oncology. And that's all for me. Thank you very much for your attention.
So this is my turn, I think. I'm going to share my slides. Can you see it?
Yeah, we can see it.
Thank you. Well, first of all, good afternoon, and thank you very much for this invitation. It's an honor for me to be here. My name is Isabel Martinez. I'm a pediatric oncologist in La Paz Hospital in Madrid, Spain. And as Hannah said, I had 2 years ago, I had the opportunity to spend 2 months at the PEHSU in Murcia with Dr. Ortega and his team, learning and working. And this experience, as a result of this experience, we became aware of the crucial role of environmental health in pediatric oncology. For that, we have just opened this year a specific consultation in our department, in the Pediatric Oncology Department in Hospital La Paz in Madrid. And I'm going to tell you about it. Well, first question, why? Why is important an environmental health consultation in pediatric oncology? Well, there are a lot of reasons, but main are here. We'll talk about desposome and how it is linked to the whole cancer continuum. We'll see also the importance of the pediatric environmental history, as Dr. Ortega says. This is an opportunity to strengthen scientific evidence in this area. And lastly, all these issues are even more relevant in pediatrics, becoming a matter of social justice because of the child vulnerability. Well, desposome, this is just to remember the importance of desposome in pediatric oncology. We all know that genome and desposome are deeply interrelated. In recent years, we think that our understanding of the relationship between genes and cancer has greatly grown, but we need to incorporate the role of environmental factors to fully understand the entire process of cancer, as we can see here. Here, I have summarized two main ideas from the Convention of the Right of the Child that took part in 1989, that for me are very important in this context of environmental health. In general terms, it says that according to the treaty primary tenets, children are individuals with human rights, and childhood is an special protected time separate from adulthood, during which children should be allowed to grow, develop, and thrive with dignity. And more specifically, in Article 24 of the treaty, it establishes children's right to optimal health, healthcare access, and the provision of adequate nutritious foods and clean drinking water, taking into consideration the danger and risks of environmental pollution. Oh, sorry. Well, this diagram publishes in 2019 shows the whole influence of environmental and social factors through the entire cancer continuum. And for that, for me, is key. It's a key, good visual idea or concept. It shows also how unequal attention to this factor can be a source of inequality among patients. And in this other work, published very recently in 2025, it reflects very well how pediatric environmental health is currently an unmet need, mainly due to the lack of specific training many times. This survey, the results of this survey shown here, shows how, despite the great interest from families, we are, as health practitioners, doctor, nurse, and all the health practitioners, we are not prepared yet, we think. Well, this workflow, very simple, but shows that implementing this specific consultation, this pediatric environmental health consultation in pediatric oncology, allows us to systematically compile many environmental information, being the green page an essential tool in this process. This information will be used for implementing a specific intervention to the patient and his family, as Francisco said. And on the other hand, this information will be very useful to carry populational studies that could generate more scientific evidence. Well, here in this slide, we can see in detail some of the most relevant interventions that we can carry out in this consultation. Green page, as we say, is a basic tool to obtain specific environmental information. On the risk assessment, here, we don't only focus on the disease, but also in other factors that can influence in it. Well, when the patient finishes treatment, the oncologic treatment, before they move forward, we need to check the assessment and make a plan for the future. And this is really, really important. At the end, during their whole life, in the long-term follow-up, we need to make a plan involving, and this is really important, involving the general practitioner and the general medicine and doctor, nurses, and also involving the patients themselves. Well, here we have summarized how environmental factors have a dynamic influence in the whole process of cancer. From diagnosis, and this is a key also, from diagnosis during treatment and to the follow-up. And this is a really dynamic process that we can repeat through the whole process. And we must repeat and check during the whole process of cancer. Well, but what are we going to do with all this information? I try to summarize in this slide, in this image. Well, the main idea, I think that we have to take actions. This is the most important idea. We will try to create your referencing maps to guide dynamic spatiotemporal analysis. By knowing the location, we can look into about potential causes. Second, we will try to identify biomarkers of exposure, susceptibility, gene-environment interaction, and treatment response. And lastly, we will try to develop predictive models to improve prognosis and personalize therapeutic intervention based on each patient's characteristic on each patient profile. Well, to highlight what we have discussed in this meeting, I have 3 insights. First, that environmental health is a cooperative work. This is a key also, and we are, this is a very important concept that we have to remember always. Second, is an holistic and humanistic approach, and we would like it to be a seed from which to create alliance, networks, and connections. Well, this is all for me. Gracias. Muchas gracias. Thank you very much. Well, it's all. Thank you.
So I think that now it's my turn. First of all, good afternoon to everyone. Thanks for this opportunity. It's a big opportunity for me. My name is Alba. I work as a pediatric resident at Sant Joan de Déu Hospital in Barcelona, and I'm currently doing my elective placement in Murcia's PEHSU. Now I'm going to talk about long-term follow-up program for childhood and youth cancer survivors and my experience here in the PEHSU. We all know that cancer has a multifactorial etiology, and one of the most important factors is the environment. Not just patient's environment, but also parents and grandparents. As Dr. Ortega has said, there is an increased incidence of cancer, probably because of the pollution, lifestyles, etc. But also the chance of survival has increased, and with it, we have to face new challenges as late effects, life expectancy, quality of life. For this reason, Murcia PEHSU has created long-term follow-up program for childhood and youth cancer survivor, and this program started over 20 years ago and has treated more than 900 patients. Nowadays integrates the hospital with primary care and community. The basis of this program are individualized lifelong follow-up based on a specific risk, type of cancer, treatment received, genetic predisposition, comorbidities, and environment, in order to prevent, anticipate, and address complications and comorbidities, and achieve the best possible quality of life. It has two goals. The first one, to reduce environmental risk factors and promote healthy environments to improve the quality of life for the survivors and their families. And the second one, to reduce risks related to the disease and the treatments used. To achieve this, we use the environmental clinical history. This is a simple and affordable tool that improves etiological and prognostic judgment, and it also promotes healthier environments and lifestyles, and it's a social innovation. The environmental clinical history consists in 4 parts. They has been explained for Dr. Martinez a little bit, but the first one is a basic environmental screening, and it's on a diagnosis, and we talk about all these topics. And then the second one is a 90-value risk assessment, and it's done 1 to 4 months later. And we look for assessment of environmental and constitutional risk factors. We assess the quality of life. We promote a healthy lifestyle. We assess of personal, family, home, neighbor, and school risk, etc. Then we have 2 more parts, the green passport and long-term shared follow-up. I've been working mostly in these 2 parts during my rotation here in the unit. The green passport is done at the end of the treatment, and it's for primary care. We summarize the treatment and emphasizing the type of treatment, surgery, radiotherapy, chemotherapy, the doses, and the possible complications. We recommend a specific follow-up depending of each patient to look for potential late effects. And we also promote healthy lifestyles, no smoking, no alcohol or other drugs, and we work on drug cessation programs. We also assess and monitor the quality of life of each patient in every visit, and we look for physico-social support. And the last part is the long-term shared follow-up with primary care. We also promote care and expression of, we also promote the self-care and empowerment of young people with illness. So, as my experience, I think that my experience is positive. Patients really trust in our medical criteria and ask to continue with the following up because of the global but detailing because of the global but detailed approachment. One of I would like to highlight that some of the most frequent comorbidities that I have seen and we have to work on is obesity, infertility, depression, etc. So we have to create a network with other colleagues to assess these new late effects and to give some answers to the patients. We really try to explain to the patients the need to take care of their lifestyle habits because we think that improving these will offset the effects of the medication received, for example, cardiovascular risk. And we also carry out a comprehensive assessment of the environment and their families. We really want a smoke-free house and a safe environment. And we also accompany patients in the transition from children to young adults and empower them in the understanding of the illness. As conclusion, every child with cancer has the right to through environmental history. Survival begins on the day of diagnosis, and the biomic approach is a clinical, ethical, and environmental responsibility. Thank you.
Thank you all so much. That was really, really awesome. I feel like every time I hear you guys present, and when I went there, I learned more and more about the amazing work you guys have been doing in Spain. We have a few minutes for questions. So we had a few come into the chat, and I'll just read them out if anybody is able to answer. So Dr. Shaquille said this is an incredibly compelling work from Juan and his colleagues. From an implementation standpoint, what have been the biggest barriers to integrating environmental health into active pediatric oncology care? And so thankful and grateful to learn from you guys.
The first barrier is we need training information of the people, of the pediatrician with another colleagues to develop. For example, when many people say, Juan, only one questionnaire to pass to the one questionnaire for the patient. No, we need develop capacities in environmental health to face with the parent when the parents say, why my child will have cancer? The pollution at home with another question. We need training information. The first barrier, the most important for me, is the barrier. We need training information in environmental health of the clinician in the world. So yo vivo, I think it's 25 years working in environmental health. The last year we have incorporated a subject in our medical school and in pediatric environmental health. 25 years to introduce in school medicine, in our school medicine. So step by step, we need training information. Many people say the problem of the money, but in Spain, the public health system, the key for us, I don't know in other countries, but the key for us is we need training information of the people to incorporate pediatric environmental history. When the parents, when the oncology team prove good the environmental history is easily. We need incorporate these capacities and train information of the nurse, medical doctor with another.
And Dr. Martinez, from your standpoint, I know you're just starting your program in Madrid. Any thoughts on that question?
Fran, I would like to know, you explain the fair results, because the epidemic, the flu, pass on the patient. There is not admission in hospital related with respiratory and no program admission.
Yeah, actually, we don't have any admission with viral infection. That the winter was so strong in Murcia, and we are so happy with the preliminary result, because we know that only 6 families, but at the moment we have any admission with virus or respiratory virus or similar.
Mm. Mm. Mm.
And I have to add another aspect that I can explain. And we measure the sugar of the water they drink, like the osmosis or similar filter, carbon filter, the type of pets that they have. We measure simple markers such as cotinine in urine and the level of atmospheric pollution, but which we store for later analysis.
Well, I think in this meeting it's important to say we need, okay, all children with cancer need a pediatric environmental history to improve, to know aspect related to etiology and prognostic. But I think I know the work, for example, in many people develop long-term follow-up program in childhood with cancer, but environmental, we need begin from diagnosis. Díaz zero, start environmental health action to improve mortality and morbidity related with treatment. Okay, maybe I don't know exactly the relationship with the effect in the long-term survival or the etiology of the cancer, but tobacco smoke exposure is a risk factor modifiable related with the mortality related with treatment. So we need develop and searching, looking for another risk factor modifiable from diagnosis. We need to incorporate biomarker. We need to incorporate environmental biomarker, environmental history from diagnosis. No start survival program of the end of the treatment of the cancer, because it's later. It's later. So we need to start begin from día cero, Aumestin, Rio Arriba, incorporate all capacities of the environmental health to improve quality of life, to improve survival rates, to diminish mortality related with treatment. I think it's very important. We need together to go our steam, Rio Arriba.
Thank you so much. And I think that kind of brings us to Dr. Wolf had a question too. He said, excellent presentation. How is your intervention received by parents? Are they skeptical, defensive? Are they grateful? And how is the follow through of your recommendations?
The most important in our program is the trust with the patient and families. How receives the information the parents? Is thank you, Dr. Ortega. I have during many years to find a doctor with deliberation with this question. Contrarily, when the parents and the family as the most important aliados and participate and collaborate and self-care is very extraordinary. I am working in pediatric environmental health in childhood with cancer with this happy, this illusion and very esperanza because the family transmit this spirit because see if not it's difficult so we need to incorporate pediatric environmental history in all children with cancer in the planet. So it's a responsibility. So including the family of the children death, when the first time when you offer the possibility of the pediatric environmental history, including in this family, in this moment, you say clearly, we need offer because the families say, thank you, Dr. Ortega, maybe my other children or the useful for other families or other societies. So, no, I don't know barrier in the families. The families searching environmental pediatrician to they have question. They are looking for professional to respond at this question. So we need increase training and capacity building.
I would like to add that in my experience that it's more short because we've just started right now in this year. Families are really grateful and they look for you and they say what they say. I'm here about this consultation, this new consultation. I would like to have an interview with you because, well, for me it's important. I think this is important. So I think that families are really receptive to that, is in my opinion.
That's great. It's great experience as you're just starting out on it in La Paz and the Madrid. That's awesome. Well, thank you guys again. I know we're just getting right onto the hour, so I just wanted to quick share my slides again with the audience. So mark your calendar for our next webinar, which will be at the end of April. Dr. Wemos will be talking about perinatal environmental exposures and pediatric cancer risks. So that'll be really another excellent presentation and sort of highlighting the perinatal window. And then if anybody is interested, we have our ongoing newsletter, which has a lot of great information on CSEP's activities, as well as sort of the kind of current literature and current topics around childhood cancer and the environment. And then lastly, we just would love your feedback. We just started doing these surveys, and I feel like they've been really great and really helpful in informing our future webinars, as well as what people are interested in hearing from the audience. So I really appreciate your feedback. I'm just going to leave this up as people leave the webinar. But again, I just wanted to thank the speakers so much for your really wealth of experience. And I'm so grateful to hear about the families who you have served through this program in Murcia and now in Madrid. So thank you so much, everybody. And thank you for participating. I hope everybody on the East Coast who's getting a lot of snow stays warm and dry. And you guys have a good evening. I know it's very late in Spain. See everyone later.
Much.